So, Isabel, I'll present you. So you're the mother of a young man living with a rare disease, and you had some knowledge to start with a post-secondary degree in biology to become, well, a very good, strong advocate for your son, and all that personal lived experience with disability, and also a patient partner in research and an advocate for patient partnership in research too. So, but for your background, you were the founding past chair of the Rare Desease Foundation. And under your leadership, you started the program, which is called Microgrant Research Program. So you give out some microgrants, some small funding to at least start some research on some rare diseases which are neglected maybe by our funding agencies in Canada. You're now the strategic lead in patient partnerships in the Chambers Lab, Dr. Christine Chambers, who at Dalhousie University. And the co-chair for the Patient and Caregiver Advisory Council for SKIP, which is Solutions for Kids in Pain, and which is wonderful because I think the mission there is really to get the evidence-based solutions research to the bedside for kids who have pain. So that's great. You've been present in a lot of international rare disease meetings. You were interviewed on CBC Radio. You write blog posts, and you even co-authored charters with the Patients Included movement. And you also received an award from the Canadian Organization of Rare Disorders and Patient Safety and Quality Council Quality Award in advancing the patient voice. So I think that's the main thing we have to take out here about you, is that you draw, as you wrote, draw from your lived experience to provide leadership and guidance in healthcare and healthcare research to support meaningful patient engagement practices and partnerships that are aligned with patient-oriented research. But today, you're going to start by telling us your journey, because you also went through a diagnostic odyssey with your son, and we're also we'll discuss maybe your advocacy, the mission, and also partnerships. And also we'll be launching the Living Without a Diagnosis Guide from the Rare Foundation, which was published under your reign at the Rare Desease Foundation, and you participated in that research. So I'll let you present now.
Well, thank you very much. I think if I'm ever having a low day, I should have somebody read my bio. That sounded much better than I typically feel on a given day. Let me just get my screen ready to share here. And I'm just going to ask you, does everybody see a slide there?
Yes, yes, we do.
Super, I love it when a plan comes together. Okay, well, thanks very much for your kind introduction, Gail. And merci beaucoup to the interpreters who will be translating my words into French as I go. I will try really hard not to speak too fast, but it's really difficult for me. So apologies in advance to the interpreters. So I'd like to recognize before I start that I'm grateful to be speaking from the traditional unceded territories of the Squamish people, more commonly known as Squamish, BC, here on the west coast of Canada, where I'm very grateful to live, learn, work, and play here. Our family's been here for about 25 years, and we just feel very fortunate that we are located here. I know definitely from the previous presentation that resonated quite a lot with me, that many of you logging in and watching come from a very similar journey of searching for a diagnosis that I'll be talking about. And today I'd like to reflect a little on how that's affected our family, how it's affected me personally, and what I think we could be doing better as a society to support people in this space. Oh, there we go. For a second, the slide wasn't going. So let me tell you a little bit about me. This photo, I'm the woman on the right of the screen. I'm mom to Zach, who's at the bottom. He's an amazing 20-year-old now, and Evie, who's incredibly 17 and a wonderful sister to her brother, wife to Tyler, the bearded Norwegian over there. I identify myself as a writer, a big science fiction fan, and a person who never really saw herself doing the kind of work she's doing right now. Before having kids, I did contract freelance work as a writer. Basically, if somebody said, "Can you do this?" I'd say, "Sure, why not? I could try to do that." I also did a little bit of science communication. I did, however, have a history of pain and health issues, mingling with times of overdoing adrenaline sports, which made me very happy. And it made me realize that I think on some level, as I look back, that a commitment of a 9-to-5 job would never really work out for me. Things always tended to be very erratic with my health and my ability. I was hopeful that this career as a writer would build as I got older and would give me the kind of flexibility that I thought I would need going forward. So, however, when Zach was born a little over 20 years ago, little did I know how much our lives would change. He seemed healthy, just like our previous speaker, Claudia, said. It's amazing how similar stories can be. When he was born, everything seemed good. He was healthy but small. But by the time he was a toddler, we knew something was going very wrong. And we set off on our own diagnostic journey, or we called it our medical mystery tour, looking for answers. And in turn, he was our first. So we were getting dismissed as hysterical first-time overachieving parents, or just sent off with kind of a big shrug to another referral in the hopes that somebody else could help us in the system. It was incredibly discouraging. It was difficult at times to maintain our conviction that we needed to find out what was going on, as the medical system kept putting barriers in our way. Instead of telling us that we were doing the right thing, they were telling us that we just needed to stop. In many ways, it reminded me of my own experience as a youth and a young adult in a healthcare system, and why I was so uncomfortable advocating for myself with my own healthcare providers. Always being told no, always going to tests and nothing coming up. What was different this time, it was for my baby, not for myself. And I had the feeling that nothing was going to get in my way. And this difference of it being for him rather than for myself felt very, very different. So this kept going on from about the age of 1.5 years. So with every appointment, going back and forth with every specialist, with every new speech therapist, and there were a lot, every physiotherapist or occupational therapist, and we're in a small town, so they kept leaving. I think there were 7 before he was 4. It kind of felt like we were wading slowly deeper and deeper into unknown waters. Part of us kept thinking things were just going to get better or equalize because so many people told us that they would. And instead, they didn't. He just kept needing more help and falling further behind in many ways from his peers. But when Zach was about 4.5, we had an appointment with medical genetics. And to be honest, I had that same feeling I always had of anxiety when I saw a new specialist, a feeling that I had for my own personal appointments that just kept getting worse with appointments for Zach. But this appointment ended up meaning so much to us. And not because we got a diagnosis from it. No, we wouldn't get to that for quite some time later. But for the first time, a doctor confirmed to us that we were right to look, that there was something genetic, likely pulling all of Zach's challenges and traits together. And this was a huge relief. Because on some level, we knew that we were right to keep looking. It was very validating. But it was also shocking, because we were right to keep looking, and there really was something happening. And it also wasn't quite what we needed. We needed answers, and it didn't give us those answers. Because while it concluded that there was something was going on, it wasn't anything they could diagnose. I've since called this our undiagnosis day. We found out something, but not something we could hang our hat on. We were told to go home, to be vigilant, because probably there might be some healthcare concerns coming, but we couldn't tell what they would be. We were told, don't over-medicalize Zach because that would be traumatic for him, but to, make sure we were watchful. And how do you do that? It took 3 years for us to get to that sort of answer. It was satisfying, but frustrating and scary, truly scary, not to have more information to be proactive about his health. We were essentially on our own to figure out what was needed or could need in a future we couldn't predict. It felt like we were set adrift in the ocean. The following years saw our family navigate the rare disease experience through healthcare, social and education systems. I learned how to be a nurse, like most of parents in this space, an advocate, a researcher. I built spreadsheets, I sent emails, I problem solved, attempted to build a team around us that could see Zach for the whole human being that he is instead of a set of parts, that could center their work around him, not themselves, not me, but him. And boy, that's a job. As I became Zach's advocate and Zach's teacher in how to advocate for himself in systems of care that still too often that see themselves as doing things for him, to him, for him, and really they need to move to do things with him and with families and caregivers. That piece of moving that advocacy for Zach himself was really important to me and to my husband. This whole time without a diagnosis, we attempted to navigate his medical care, hoping that we could anticipate urgent medical needs without knowing what those needs could be or what a medical emergency might come up or what it would even look like. And I'm hoping this metaphor translates into French, but in English, suddenly the other shoe dropped. And when he was 6, actually on his 6th birthday was the x-ray, we found an unbelievably rare tumor in his jaw. Actually, in a place that they don't normally even find that unbelievably rare tumor. It's normally in the long bones of the leg. It was a desmoplastic fibroma of the bone. So was this tumor related to his genetic undiagnosis? Who knows? With no diagnosis, with no prognosis, it's impossible to know what may be connected to what. Zach ended up having a 14.5-hour surgery that removed his right mandible from joint to 6-year molar and replaced it with a standing rib bone. After a tracheostomy to help him breathe, they had to do in surgery as well because of the swelling. 8 days in the ICU, 14 days in hospital. He was ready to come home on Christmas Eve. Those 2 weeks changed me profoundly. It became abundantly clear that without a diagnosis, it was incredibly difficult to understand why Zach wasn't reacting as usual to medications, especially in the PICU, and to procedures. Without a diagnosis, we had no power to advocate that our knowledge as his parents was the correct knowledge when things had to be done a different way. His time in the PICU was made that much more difficult for him because of his rarity, because of his lack of diagnosis, and because nobody listened to us until he was essentially tortured and people could see for themselves how much pain he was in. He experienced unnecessary pain, and we all experienced unnecessary trauma because of it. When we were finally home, as he healed or ended up not healing after surgery, it was difficult to understand or even to get any clinician to actually engage with us as to why he was having so much time with his such a difficult time with his post-surgical healing. We had no signposts based on a diagnosis that could indicate what his healing time should be or what we could do to make it better. We had nobody's previous experience to help him. Like before, we were alone. The years passed, and my role as health coordinator only grew as Zach's medical team grew, and we were no closer to diagnosis despite ongoing efforts. His health became increasingly affected after adolescence, or as he went into adolescence. And I was left to navigate a system to get accommodations for Zach for his disability without the benefit of any real explanation as to why his needs were what they were, what his prognosis looked like, and why the only constant was change. I became a researcher, like so many of us in this situation, a record keeper, an advocate, forgot to do this, an advocate, somebody who kept records. Too far, I went too far, sorry. A healthcare provider, all just while trying to be his and his sister's mom. It was, and it still continues to be, as they're 20 and 17, a lot of balls to keep juggling in the air. And really it feels like I'm juggling flaming torches, not balls, with a lot of consequences if I drop any one of them. It became clear that what we needed quite early on, in the absence of a diagnosis, was at least a community, other families who could help us navigate these systems that we shared. It was out of that need that I became involved with a group of people that would become the founders of the Rare Desease Foundation. This was when Zach was about 8 or 9. This community gave many more resources than the medical system did. Together we created resources for one another, leaned on one another, and learned from one another. Those of us that live in the ultra-rare and undiagnosed world, we're a lifeline to one another. We're an untapped resource for the health and health resource systems, health research systems, with a collective body of knowledge that had the potential to impact care for many others. And we kept talking about this, about how we could make the system better, and how do we make that happen? So Zach, as I mentioned, was about 1.5 years old when we started wading into this medical system looking for answers. Our journey took us to countless doctors, nurses, therapy providers. Somebody once asked me to try to count how many we'd seen or how many needle pokes he'd had, and I laughed. There's absolutely no way I could figure that out. Throughout it all, we kept looking for answers. Why? Because we knew that even without a treatment, there was a value to getting a diagnosis. Applying for federal disability tax credit, getting accommodations at school, even being able to have conversations with others in our community, outside of the rare disease community, I'm talking about the typical community, the normies, as we like to call them, about Zach's health, are all easier with a diagnosis. We didn't know if he'd ever get there, but we had to keep trying. It was important to Zach. We had to keep trying at 14 when his pediatric cardiologist dismissed our concerns and told Zach he just had to get on with his life, because if he had a rare disease, it would have been diagnosed by now. We had to keep trying when it was implied that Zach could be malingering or that he'd just grow out of his disability. Our persistence, and frankly, his persistence and determination, because I have to tell you, he's an incredible human being, finally got him somewhere. When he was 16, he was finally partially diagnosed. And I say partially. It's interesting because when we first started on this diagnosis journey, scientific thinking on rare disease was that lightning only struck once. When we first started going to medical genetics, it was thought that it must be one diagnosis that would fit all of the things that we'd seen in him, all of his health challenges. And nothing characterized could really explain everything. However, by the time he was 16, a lot of thinking had changed in the rare disease world, in the rare disease research world, and that I think the study that we looked at was between 2 and 7% of people with a rare disease have more than one rare disease. So our medical geneticist took a step back, and Zach was diagnosed with Ehlers-Danlos syndrome, hypermobility type. And it was concluded he likely has something else going on that isn't characterized. Maybe one day we'll have a diagnosis for that too. So, up to this, I've presented and written about lots before. I've talked about this journey, I don't even know how many times. But this next bit I'm going to tell you, this bit's just for you. Zach's partial diagnosis in many ways wasn't a surprise. We'd spoken with his geneticist before about Zach having a connective tissue disorder, like EDS. But one of the main questions asked of me, because of the strong family, genetic connection, was, does what Zach is going through look like the health problems you had and continue to have? And I always answered no, because while I shared some things with Zach, there were lots of things we didn't share that was what we decided was part of what was going on with him genetically. But here's the plot twist. If we conclude that he has more than one diagnosis and one of them is EDS, well, then that starts to look a lot more like me. When Zach was diagnosed, our doctor used the International Classification Scale to see if the diagnosis fit. We brought it home to talk about it and, tell his sister about it and tell our family about it. I kept looking at it. I couldn't help but see that I met all of the criteria as well, like super met all of the criteria. However, I really wasn't ready to deal with it, to be honest. And I can't really tell you why I was so keen to get a diagnosis for Zach and then so reluctant to get my own diagnosis. And maybe it came from a lifetime of being gaslit by medical professionals about my own symptoms, about hiding my disability and my own internalized ableism so that I could pass as typical. I'd framed my life in a certain way, and this could change everything. Sorry, this is a bit hard to talk about, as it turns out. More than a year later, I finally mentioned it to Zach, nobody else in my family but Zach, and asked him what to do. He said I should talk to a medical geneticist, Dr. Milan Patel. He's a smart kid, that guy. Don't tell him I said that. Our next appointment for Zach was heavy, and I can't even remember what it was about, but there was stuff about Zach that we had to deal with. And at the end of the appointment, I'd already decided I didn't want to talk about my own stuff. I thought to myself, today is about Zach, or at least that was my excuse. I really just didn't want to deal with my own health reality. So we got to the end of the appointment, as we usually do with Dr. Patel. And he said, as usual, so what have I missed? What else do you want to talk to me about? Is there anything else we need to look into? He's really great that way. Complete silence for me. I was not going to say anything. And then Zach says, Mom, didn't you want to talk to Dr. Patel about the chance you could have EDS? Well, damn it. I guess my rotten 18-year-old was going to make me deal with my reality. And good for him. So after that, I ended up at the age of 49 getting my own diagnosis after years of not wanting to deal with it, years of developing my own anxiety about telling healthcare providers about my own medical symptoms. I was diagnosed with Ehlers-Danlos syndrome, hypermobility type, thanks to my son. So, is that it? Is the story over? Well, obviously not. First of all, HEDS doesn't have great treatments, and not a lot of research is happening in the area. So from a personal point of view and a family point of view, we're still looking for answers. And of course, there's that whole what else is going on with Zach that isn't described by his partial diagnosis, and what medical surprises might still be in store. But at least when interacting with systems of care, when looking for accessibility accommodations for university, when interacting with government institutions, Zach has a diagnosis that can put a box around many of his accommodation needs. And that is something that really matters. But beyond our family experience, beyond Zach, beyond me, what's the lesson here? Is there a lesson here? Our family, like so many others, has spent an inordinate amount of time embedded in a healthcare system. And like many who live with medical complexity, we have a view that spans across clinics, across specialties, and even separate institutions. Many of our interactions have been in a paternalistic system that wants to tell us what to do or what to expect without looking for our input. We value those clinicians who move away from that system towards patient-centered care. And then there's those unicorns that move towards patient-partnered care and really can work together with them. And then we wonder why it can't all be like that. We interact with research, those of us in the rare disease world, more than other people, looking for answers, either reading about it or looking for research projects we can participate in. There's a breadth in our expertise as people with lived experiences that's been traditionally ignored in healthcare research, and in medical education. It has become my passion, personally, to work with people in healthcare and healthcare research to help them integrate patient partners, people with lived experience, into their work. Increasingly, this is being seen as a type of expertise that has been absent from decision-making on service delivery and in research priorities. It's in policy making a little bit more now. Like the apocryphal elephant being examined by blindfolded individuals, nobody knows it's an elephant unless all the perspectives are put together, and importantly, until all those perspectives are respected and they listen to one another. I fundamentally believe that our healthcare experiences would have been less traumatizing and would have had better outcomes had patient partnership been part of healthcare design, delivery, and research a long time ago. So, not just a passion. Now, as was mentioned in my bio, I'm now working with researchers and healthcare providers on what it means to partner with patients, how they can work with people with lived experience in an equitable way to improve the work they're doing. Only when this is done well can the system be the best it can be for everyone, not just patients and families, but also providers, because they're in the system too. So finally, I'd like to leave you with the parting words of the incredible Aretha Franklin, remembering whether it's in patient-partnered care in our own personal lives or in patient partnership opportunities as we help guide the system, respect is what we need and what we should expect. So thank you very much for letting me share my story, and part of my story that I've never actually shared publicly before. So thank you very much.
Thank you, Isabel. Really, it was a nice presentation visually, and also your perspective is invaluable. One question, first about the story part, your journey. You've, I think one of your interviews on CBC Radio was on white coat, black art, and I think I listened to it some time ago. And if I remember well, it was about post-traumatic stress syndrome.
Yep.
And it's something that we don't talk about a lot yet in the rare disease community. Some families here have tried to express that some of the traumas, they're living some traumas, especially when they're not believed in the healthcare center system or not served very well with the respect they want, or these traumatic experiences that even doctors, don't know what's the cause, but I think we have to put it out there because you've expressed it, that it's true that you can, a child, I guess even, or parents, an adult, looking for
siblings,
can have a post-traumatic stress syndrome. It's talking about the mental health issues.
Yeah, that's a huge can of worms, and so I've spoken quite openly about my own medical PTSD around our experiences in healthcare, and I was really happy to do the interview. It was really difficult for me, but really important, and something that I think needs to be talked about, because there's so many of us walking around with trauma from the medical system and from our experiences, and because we don't talk about, I thought trauma, PTSD was something you got if you were a soldier or a police officer, or I didn't understand that the experiences that I had was PTSD. And instead I just bore what was happening to me until I went to a therapist and she told me that what I was experiencing was PTSD. And because I didn't know that it was a possibility, I didn't seek help for it until it was quite embedded in me. And PTSD is one of those things, the sooner you seek help for it, the less likely it is to stay with you longer. My daughter, Zach's sister, has medical PTSD from seeing her brother in the PICU, from our middle of the night emergency room runs. And again, I didn't know that this was something a little child could get from her brother. And it's affected her ability to seek her own health care, even now at 17, a reluctance to it. I'm part of a group right now that's looking into post-traumatic stress syndrome in parents of medically complex kids. And it's interesting because one of the things that has come up in our first study is that a trusting relationship where parents' expertise is respected seems to be very protective against these traumatic stress incidents. And it's something that many of us don't have. I think people are beginning to talk about it more. I did a panel and grand rounds for Children's Hospital of Eastern Ontario in Ottawa. I'm going to say it was last year. And I think we need to talk about it more. I think it's hard for clinicians to face it because they're taught that what they're doing helps, and it does. But it's hard. I think it must be hard to face the fact that in helping you can cause trauma. But I think that if we talk about it, if we have trauma-informed approach and learn what that looks like, it can be better.
Yeah, thank you. I remember you saying that the trauma went so far as you would have reactions when you would go back to the hospital after that pediatric intensive care unit hospitalization for your son.
Yeah, there were halls I had a difficult time. Even there was this long hallway I'd go down to get to medical genetics, and where we had the Guts-X undiagnosis, which was unlike a lot of people, we had a very good undiagnosis. It was done well. Like I've heard, we've all heard horror stories about how people's diagnosis has been delivered, and ours was good, but it's still traumatic. And it's funny because that's where that office was where we had many of our Rare Desease Foundation meetings. But every time I walked down that hall, the sound of shoes walking down that hall was a trigger for me. And I didn't know it was because I didn't know what triggers were. I didn't know I had PTSD till years later. What's interesting about that is the work that I do now with partnering with patients in healthcare and healthcare research. One of the things that I tell folks that want to engage with patient partners is think about where you're having your meetings, because for many, what's convenient to them as clinician researchers is to have it like at the hospital where they work, but it excludes people for whom going there is very difficult, or it makes it easier for us to have trauma response while we're there. And so is that really the best place to be having meetings with people with lived experience? So that's one of the big things we try to teach people is like, have your meetings somewhere else. It might be a little inconvenient for you, but suck it up. Your inconvenience does not trump my trauma response.
And also following up on your work with helping with partnerships in care and research, can you give us other recommendations that you give clinicians and researchers to help getting patients involved, listening to them? hearing your perspective.
It's an exciting area to be in right now because it's really evolving rapidly. It's traditionally patient partners in research, healthcare research, have look like me, white, middle-aged ladies who are financially secure because we're easy to engage with. You know, I can speak the language of healthcare, although there's still a huge power differential between myself and a researcher. I can at least pretend that I'm not traumatized or that I'm not intimidated by the experience. But there's an increasing recognition that although we've had terrible experiences in the healthcare system, we're white, we're English, or in Quebec's case, if you're French speaking, we have a science education, for goodness sakes, both my husband and I, in financially stable. So as bad as our experiences have been, and they've been bad, there are people for whom the system we know are much, much worse. So if we can engage with the people for whom the system is really bad, we can find out what the worst barriers are and make those better. And if we make those things better, then they're better for everybody. So a lot of the work that I'm doing is not necessarily to engage with me, but how do we engage with people who have intersectional identities, who are racialized, disabled, immigrant communities. And it's not about making space at the table, but about how and where do we make the engagement comfortable for them? How do we let them be themselves? How do we understand that there are power imbalances that we need to recognize and make accommodation for? So it's a really, and it's an exciting place to be in. And for the people, the clinician researchers, the researchers that want to do this work, to have them understand that this isn't about just another meeting. It's about creating relationships with people to really do good work. Because in the end, you do better work as a researcher. I'm really excited about it.
Yes. And something I think you went through, people in our organization went through, as you said, it's evolving, this concept of patient partnership, really engaging with patients, is something that I think the healthcare professionals, clinicians, researchers have to go forward on, is that they invite them, patients, caregivers, parents, but, you know, sometimes they don't like what they hear.
And I think that's the value of one of the things that I talk a lot about is patient engagement isn't a side of the desk endeavor. Like, it's important, if it isn't something you know how to do, to hire somebody who does, to create an opportunity. Like, if you're not ready to be uncomfortable, you shouldn't be doing it because you're going to traumatize somebody, and that's not right. So if you're not ready to be humble, and to one of my favorite, Dr. Christine Chambers, who I work with a lot, one of the things I said to her quite early on was, people need to stay in their lane. So when you have a research team, you know, the main investigator puts somebody on their team who's a statistician. They put somebody on their team who's a knowledge translation expert. You know, the team is made up of it's that elephant with everybody looking at a different perspective. So it's a coming to an understanding that that patient experience is patient expertise and a full team member on the research team, not somebody who's there to tell a story to make you feel something. It's expertise that when you need that expertise, you don't dismiss it. You have it integrated. So that's the learning journey for people doing research. And if a researcher isn't ready to do that, then they absolutely should not be doing patient-partnered research, because they'll harm people.
Yes, well, I think that's the principle of patient partnerships, and sometimes some clinicians, researchers don't want to say that patients are expert. They want to say that you have experience with your disease. We know, and I think a lot of patients know, that they also are often experts of a rare disease, that they know more than...
Yeah. And it goes beyond that too, because we're experts in the healthcare system. We're experts on how that disease experience interacts with clinics and hospitals and research. And, you know, healthcare research is science, but it's also social science. And what you choose to research and what bits are important is should be hugely informed by patient expertise.
Exactly. Well, thank you very much for also answering my questions. And I think we'll we'll present the guide. That was a microgrant project, I think, under when you were president of Rare Desease Foundation. And we'll present that, and after, well, if we can, take one or two questions from our audience. I'll show the, I think I can do that, share the guide. I hope I don't. Let's see all my.
Oh, there you go.
You have it? You see it full? It's not full screen.
Not quite full screen.
There. Okay, so I'm showing the French version because that's what we're launching today. So the Rare Desease Foundation was very nice with accepting to our offer to translate the guide. So it was living without a diagnosis. And yeah, maybe you can tell us the story, and I'll show a bit of the content too.
Sure. So this was one of our microgrants, and the way the microgrants work is that anybody who worked, I don't think they're doing them anymore right now, is anybody who had an idea about any rare disease or anything affecting rare disease could submit a one-page grant request. And this came from two, I think it was genetic counseling students, and it was a guide. Their idea was to create a guide with families about helping folks without a diagnosis and what they might need. I have to say this is one of my absolute favorite microgrants that we ever did. And the way it came out, it was one of those things that I so wished I would have had when we got our undiagnosis. The way that the genetic counseling students, they were based in Vancouver, the program there, is they worked with a parent-to-parent resource network, which was the parent network based out of Vancouver, and talked to parents there about what their needs were, what they would have looked for, what was missing in their life, what we got from one another in the parent network as we spoke to one another, and out of that they created a draft, came back to us again, got some quotes from their interviews that they had with parents, and came back with, I'm going to say it was 2 or 3 drafts till they had the final one. And then they set about to send it off to as many genetics departments as they could, and they made it so that there was room for people to add their own information to it. So I just, like I said, this is one of my absolute favorite. You know, we did, I don't even know how many microgrants we did, hundreds, and this is absolutely one of my favorites.
Oh, I guess it resonated a lot with you.
It really did.
So there's something I'm noticing, your background at home.
This is my office.
That's your office. There's some similarities here with the...
Oh, that's funny. It's the West Coast. What can I say?
Okay.
West Coast vibe.
Must be something very common around their part of the country. So, yeah, on the table of contents, well, we translate it, but there's obviously an introduction about living without a diagnosis. They talk about the team you can build with. It talks mostly to parents, speaks mostly to parents who have a children undiagnosed, but I think the recommendations, the suggestions are good for adults too, and how to organize all those medical appointments, how to manage them, and your support system around you. So we did speak about that a bit this morning, about family, friends, how you can lose some, how you can maybe build other relationships to help. And it was the same thing actually for the healthcare providers, that it's even said in there, it may happen that you have to dump something like that. It was like, I think the terms that were used, divorced or
fire.
From fire.
Yeah. We had a few meetings at the Vancouver Parent-to-Parent Resource Network on firing your healthcare provider.
Okay, firing a healthcare provider that doesn't listen or doesn't. So there are some suggestions like that. And then there's the path to empowerment. Now, sometimes in French we have to use the English word because there's no right translation. There is a translation, and maybe our interpreter, I don't know if we'll be using it, but it's so bureaucratic. So it takes the power out of the term empowerment. So we kept it in. And how finally, and I think you talked about that phase in your journey, how you finally at one point arrived at a point where I guess you start taking more control of your life and your family's life with your son with this eye-nose disease. How to give, I don't remember in English what it is, how to give meaning to all this. And there are resources, and there is that last page about how the booklet came to be done. So it's really beautiful guide. It's simple, and there's all these. These are quotes from family. A lot of quotes. I'm sure there's a quote from you in here somewhere. I think.
They're all anonymous, so I think I have a feeling I'm in there somewhere.
And I think what I'd like to tell people before they read it, and I guess they should, is that this one here, people were saying that, if people told me in advance, if I had this guide, I guess, and people told me in advance how this is with all the uncertainty and everything, maybe I could have, managed it better. But so that's one of the things I took out of it. And so there is some very factual information about the kind of specialists you could see, either clinicians and other health professionals, and tests that are done to explain. And I think this is a very nice section about people around you, how to build those positive relationships with the health team and with your surroundings, your family, your friends. So, and lots of these quotes again with some answers, which probably came from parents, also the answers. And, yeah. And then there's also, all these tips to keep all those medical records, how to approach the doctor, ask questions, your support system in your life with family and friends, how to take care of yourself. I guess that's always a good, very essential. If you don't take care of yourself, well, how can you go through this and take care of the undiagnosed person and the rest of your family, and how to get that empowerment, even get resources. So it's really comprehensive. And then there's the resources at the end, what the Rare Desease Foundation offers, the other organizations. And so here it is. So this is, so we thank the Rare Desease Foundation for letting us translate this and disseminate it. It's on our, for now, there's a link on our website. Obviously, it's going to be on the Rare Desease Foundation website too, and with the English version. So this is really we're really happy to be able to offer this to Francophones, not only in Quebec, but the rest of Canada too.
I'm so happy that this has been translated to French now. That was something that I really wanted done for a long time. So this just makes me so very pleased. Thank you for this.
Well, thank you and the Rare Disease Foundation. So we have a couple of minutes. Luc, I don't see I don't have to see it, but if there are some, I think, oh yeah, there was a question in the chat, I think. Okay, somebody was saying, like for universal accessibility, too many people do not realize how much small changes can have a positive impact on everybody. So,
yeah, I think one of the things that I hear is everybody can use a ramp, but not everybody can use stairs. And one of the things I talk about in my patient partnership work is if you get rid of the barriers for the people that have the worst barriers, then you're making it better for everybody. So you shouldn't be trying for the easiest things. You should be working to make it better for the people that have the most difficulty in the system, because then you make it better for everybody.
Yeah, that's really wise. So. Even if they're small changes, and they can have a great impact on many people. Mm-hmm. So I don't know if there are other questions here. Whoop. Okay, so we don't have any. We'll probably take these 5 minutes more with our break, because these Zoom meetings, as long day Zoom meetings. On a Saturday, it's even sunny here in where I am in Quebec. Anyways, it's very sunny. And so after we have a workshop, which is actually on how to get support, how to go through this diagnostic odyssey, we'll be discussing. And actually, our two facilitators for the workshops today got your guide beforehand, found it wonderful, and we can go from ideas in that guide too. So thank you very much, Isabel. One day we'll be inviting you in person to Quebec.
One day we'll see people in person again. Thank you so much for inviting me, Gail, and thank you very much to the interpreters. And I hope I didn't speak too fast.
I don't think so. I'm sure it went well. Thank you very much,
Have a great
Isabel.
day, everyone.